Today being Wednesday,
Yes.
we're talking about very pertinent issues, very important issues that affect us.
Very.
Maybe we don't talk about enough,
Yeah.
and we should. We're talking about cancer.
Cancer.
I'm sure everyone listening today knows somebody who knows somebody who knows somebody
Yeah.
who is suffering from cancer.
Maze.
Whether it's an adult or
Or
a
a baby.
child.
Yeah.
Ausio,
Yeah, and today we'll narrow down to childhood cancer, Maze.
which is, I mean, how do children get cancer? How does that happen?
Crazy.
The most innocent of the society.
Yeah.
So here we are with the CEO of Faraja Cancer Support Trust, David Makumi. He's in the house.
Yeah, man.
And also Mercy Wanyora.
Yeah.
She's a parent of a child who's a cancer survivor.
Survivor.
That's what we call them, cancer survivors.
Yes.
And by the way, his cancer is just, I can't even, medulla something or other.
It's called a medulloblastoma.
Medulla
Blastoma.
blastoma.
Yeah, it
Which-
affects the back of the brain where the cerebrum is.
Right.
Yes.
And when he got it when he was how old?
He was 5 years old. It was just like any other day. He was walking, stumbling. And we wondered, why is Moses stumbling? He was walking comfortably. In 2 weeks, he could not walk. We went to hospital, the local hospital. They said this is a pediatric case. I wondered, what is a pediatric case? We were referred to a level 4 hospital. When we went to the level 4 hospital, they said, you need to do a CT scan. I told my husband, when you hear this big imaging,
Yeah.
there is going to be a problem. So we went to Kenyatta National Hospital. We did an MRI there, and the problem was there. He had a medulloblastoma, and it had to be urgently removed because it was affecting his walking, his talking. He could not talk now anymore. He could not walk without an aid. So the surgery was done there in Kenyatta National Hospital in the 19th of December 2020 in the morning by Dr. Mbore, a very good doctor. It was successful. He stayed in the ICU for 2 days, and after 2 days he was taken to the ward.
Was he able to walk?
No. When they took Moses on 19th in the morning, he was actually asking for breakfast. Mommy, can I have breakfast? Yes. That is the last time Moses talked. Yeah, when he came out of surgery, he was not talking. When you lift him up to walk to the toilet, he could not stand. He did not talk for 8 months, and he did not walk for 2 years after surgery.
What?
Yeah, that is the damage the tumor did.
Okay.
Yeah.
But the doctors were hopeful that he would talk one day or walk one day?
Yeah, they said it is going to be a journey, and he's going to talk. And today he's 9 years. Moses is talking, but with a bit stammer and a bit slur.
Right.
And he's walking. He's not on any walking aid. Actually, when he left surgery, he could not even swallow anything. So we had to put feeding tubes through his nose. He had those feeding tubes for 2 years. I became a nurse and a doctor for him because after we stayed in hospital for 4 months, from December, January, February, and March. We left hospital in March after treatment. He had the surgery, he had radiotherapy, and a bit of chemotherapy. He went through all those without any blood transfusion. The doctors were wonderful. The nurses were wonderful. Kenyatta has another image. Yeah, despite the challenges, Kenyatta has another image. They are good people there.
The good people.
I can testify that it is a system that can work properly.
You know what, Mercy? He might end up being Ronaldo or Messi. He's only 9 now.
He's a star.
You know?
A child is diagnosed with cancer every 3 hours in this country.
Every
I said
3 hours.
That gives you about 3,000 kids every year. And those are just the ones that get to be diagnosed. We believe there are lots and lots of kids out there who probably die without a diagnosis, without the right investigations, or without the right treatment. So every year, somewhere in this country, maybe by the end of your shift, there'll be a child who have been diagnosed with cancer. And the commonest cancers that we see in children include like blood cancers. People may know about leukemia, which is a blood cancer, very common in this country. Lymphomas.
Hodgkin's lymphoma.
Yeah, there are Hodgkin's and non-Hodgkin's, but they're all lymphomas. They're just one big family of cancers. We also have solid tumors or solid cancers, cancers of the kidney in children, cancers of the eye, the back of the eye, which we call the retina. It's the camera of the eye, if you want, and that is a major cause of blindness in children, and that you may get kids as young as 2 years getting that type of cancer. Bone cancers are also very, very common. So, for just as you started, just why do kids get these cancers? I mean, 1 year old or maybe months old, and they just have cancers. Cancers in children are really different from those in adults, in this sense that one, in adults we talk a great deal about, risk factors, some of them we know they are specific risk factors, but for children risk factors do not play an important role. Moses was just 5. It's not like he's done all the things that we all do, junk and binge and all those sort of things. So for many kids, we just can't give you one right answer to say this is why they got cancer. And there are few kids who may have cancer because of genetic issues, but that's a very, very small percentage. And the key thing with the cancers in children is actually the single most important thing is to detect them early and treat them very aggressively. The good news is outcomes in cancers in children are actually better than adults.
So you're saying Moses could fully recover one day?
Yeah, fully recover is putting it mildly. He'll just get back to his full potential. He's on track. The outcomes are really very good. He had surgery, he had chemo, he had radio, and he's in the process of rehabilitation.
And he didn't go to India.
And that's an important message we need to pass out there, that we don't need to take the next flight to India because a lot of good treatment is available in this country. We have experts, we have the right technology to do what was done for Moses and for kids. Obviously, we can do a lot better in terms of resources and supporting children like that, because that's where actually Faraja comes in. One of the arms of the many things that we do is actually to support children and adults who are unable to start treatment or even to complete treatment, because it costs quite a bit to treat cancer even in a public hospital. NHIF may run out, and at Faraja we do reach out and support some of those children, like Moses, with financial aid to enable them complete treatment. Completing treatment is key. If somebody is somewhere in Wajir or somewhere in Dadaab and they suspect that a child has cancer, they need to bypass all these level 3, level 2, send that child to the National Referral Hospital. It could be Kenyatta, it could be Moi Teaching and Referral, Eldoret, MTRH. They're doing an excellent job, as well as Kenyatta and other places like Ijabe. They need to bypass sending this child from dispensary to health center to sub, because that wastes time. And the specialist pediatric care for children with cancer is only available in these major, tertiary hospitals. They need, even if it's a doctor or a clinician, they need to refer that child straight away to a national center. And those centers will always get in touch with Faraja to if and where we need to be able to support. But we need not waste the time trying to figure out what it is at the lower level of healthcare for children, because time is precious.
Sure.
You know what? The survival rates in this country are extremely low.
Compared to UK and the US and Europe.
North America, Europe.
Because of what? Care, or because what? Why are survival rates low?
When we talk of a survival rate of just about 20 or 30%, it's because they're not diagnosed early enough. They'll be treated for malaria, for amoeba, for pneumonia out there, yet it is actually a cancer there. They are, the diagnosis is not made in good time, and the referral processes may waste so much time. and of course the fact that they may not be able to afford the care. Thank God, Moses, they were able to get the MRIs, the CT scans, and the whole work.
We did the MRI. They said we had to see a pediatric neurologist. There's only one in Kenyatta, and he's retired. Dr. Munyi.
What?
There's
So-
only one,
Yes. Is it true?
and he's
Yeah,
retired.
the public. Yeah,
He's
the
retired.
So what happened?
So we went to see Dr. Munyi.
The retired man?
Yeah, the retired man. He has a clinic in Kenyatta,
Right.
the Doctor's Plaza.
Yeah.
So he said, yes, and I'm a pediatric neurologist, but this case needs a surgery. So you need to see a neurosurgeon.
Neurosurgeon.
So when he went to see the neurosurgeon, he listed the hospitals where he can do the surgery. The cheapest was Kenyatta because it was coming to 450,000. The others were coming to 1.3, 2.6, like that.
Okay.
So the NHIF card in Kenyatta Private does not cover. He said you can go to Kenyatta General, but you'll have to queue. So what did we do? We did a fundraiser. It was on Thursday. And we did a WhatsApp group, and on Friday we had 100,000 to get Moses admitted. They admitted him with just 100,000. They did not ask for any more.
The general wing.
No,
the
this is the
private
private wing.
Uh-huh.
So they did the surgery, and by 1 month, the 500,000 had run out. So someone told me there's a foundation called Faraja, and I think you should reach out, because I told him I don't know what to do with my son. Once he's out of the doctor's care after surgery, he needs to go for radiotherapy. I really don't know if I'll create another WhatsApp group to get more money donated.
Yeah.
So I called Faraja. I didn't know anyone in Faraja. Actually, it was like you walk in and hello, hi, my name is Mercy. I need support. What is it? I have a son in Kenyatta Hospital, and we've run out of money, and we need to get out of the private wing. What do we do? I met Dr. Makomi. He told me, the first thing you need to get out of the private wing, because your bills are now 1.2. So I talked to a lady friend of mine. She came in and said that let them go. Since I work in Kenyatta, they'll pay the bill, and I'll be their assurance. Okay?
Yeah.
So Faraja, Dr. Makomi took us to the general wing, and we were admitted. I was discharged like on a Monday and admitted on a Tuesday. And they funded us for all the 30 sessions of radiotherapy, Faraja. They funded all of them. We stayed in hospital for another 2 months under Faraja, and now under the NHIF scheme.
And Mercy, if it wasn't for Faraja, what would you have done?
Just take my son home.
To die?
What do? You don't have money. You've asked for help. The first treatment has been done. You don't have any more money for the second treatment.
Yeah.
How much has it been so far since you started taking care of
How
your
much?
son? How much has it cost you in total?
Let's say it's about 4 million or something like that.
Yes.
Dr.
That's-
Makumi, who can afford that?
Very few
In
these
this
ones.
Kenya.
How are you able to manage this? Where do your
Yeah.
funds come from, or how are you able to ensure that families and patients get supported financially and otherwise
Yeah.
without you guys feeling exhausted financially?
If it were not for events like the one we have this Saturday, the 14th, Be Bold, Go Gold. September is the Childhood Cancer Awareness Month. We are walking out in Muguga, Karoro Forests.
Yeah.
We need all the boots on the ground.
Yeah.
Walking. And that's one of our major fundraisers, and we really get as many people. And this year we actually are really honored and profoundly humbled to have one Eliud Kipchoge join us.
Wow. The goats.
The goat himself.
Yes,
Atakuwa.
him's the greatest
Of
of
all
all
time.
times.
Yeah.
Live in person, not just an endorsement.
Yeah.
Showing up to say childhood cancer, we need to raise the bar in terms of awareness. So I can say that he's confirmed. We're really, really humbled to have people like that say, yes, this is an important discourse as a country we must start having and bring it to the forefront.
Okay, how do people get involved?
Yeah.
How do they register?
Yes,
They've heard
FarajaCancerSupport.org.
Go on.
Yeah?
Go on.
Yeah, you register at FarajaCancerSupport.org. Adults will pay 2,500. And for children, it's 1,500. You get a souvenir T-shirt. You get to meet the goat himself.
Nice.
You know, and more important, you know, we tell people, even when you come to walk, even if you are a recreational walker or recreational runner, the first thing you're actually walking for yourself, because walking is healthy. You will be supporting Faraja. There'll be lots and lots of fun activities, but importantly, walking is also good for your heart. It's good for your lungs. It's good for your muscles. We need to keep moving ourselves, you know, even without an event. So it's important that this time round, on this Saturday, we get there and walk for a very good reason. You know, creating awareness about childhood cancer, but also fundraising so that we get many more Moseses. Do I say Moseses?
Moses is very good. Really.
Cannot allow this to go on.
And there'll be entertainment.
Loads of entertainment. Loads of good cause. We need to